graduated from medical college, and when I was in my residency training program in the late 70s, if you asked me just generically or politically, what I thought about the issue, I would not have hesitated to say, look, I'm pro-choice. This was a decision between a woman or a doctor, and no one else, including the baby's dad, had anything to say about it. It's one thing, a lot of people identify themselves one way or the other, but when you're an obstetrician gynecologist and you say that, then you have to decide whether you're going to actually do abortions or not. So as part of my training, I didn't have to learn to do abortions, but I did. And right along with learning how to do deliveries and hysterectomies and everything else that obstetrician gynecologists do, I learned to do abortion.
You understand what the baby looks like at any stage of pregnancy. How did you persuade yourself that pulling these children apart in the womb is an ethical thing to do as a doctor?
Of course a doctor knows fetal development. And not only that, if you didn't, you'd be reminded of it every time you do an abortion. When you do an abortion, whether it's a suction abortion where all the contents are pulled into the suction machine in a container, or much more graphically, when you're doing a second trimester abortion, literally pulling a baby to pieces, when it's over, you have to go through the material that you obtained. You go through that suction bottle inside the machine, or you literally look at the parts that you've pulled out and you almost literally reassemble the baby. You have to take inventory. You have to make sure you got 2 arms and 2 legs and all the pieces. Because if you leave anything behind, your patient's going to come back infected, bleeding, or worse. On the other hand, when you're pro-choice, you have this mindset that says, well, I'm here to help my patient. But you're not thinking of that baby as a patient at all. You're completely ignoring that aspect of it. Your patient is that young lady. And you're going to help her get through college, or not be a single mom, or complete her, whatever it is, whatever her reasoning is, and whatever is motivating her to come there, you're there to help. For people to get an idea how big we're talking about, you literally look at your hand, the width of your hand from the tip of your finger down to your wrist. That's a 20-week baby, about that big. Not counting the legs, that's head to rump, which is the way we measure them. If you turn your hand on its side, the width of your hand is about 12 weeks. That's about how big they are at 12 weeks. And so when you're talking 24 weeks, now you're talking a hand and a half, even bigger. These kids, as I said, these are fully formed children. There's no blob of cells involved here. These are, as I said, every abortionist knows that.
For Tony and Cia Levatino, that reality was becoming harder to bear as they struggled with infertility.
When I was going through the infertility workup, I can remember so vividly coming home and locking myself in the bathroom and just sobbing my eyes out. And there were 2 ironies that were not lost on me. One, here I am married to an OB/GYN and I can't get pregnant. The other was, here I am trying to get pregnant and my husband is killing babies.
I remember very distinctly doing, my D&C abortions one morning and literally looking down and saying, gosh, I'm throwing these kids in the garbage. Wouldn't even one of these mothers allow us to take her child home to love and care, for our own? But of course it doesn't work that way. So that was the first time I really had any doubts. They said they were strictly selfish, but very definitely it was a real disconnect between killing babies in the morning and then trying to find one more number to call to see if we could find a baby of our own in the evenings.
In August of 1978, baby Heather was adopted. Shortly after, Cia became pregnant with the couple's son, Sean.
Things were good until June 23rd of 1984. And Tony was on call that day and had made rounds, and it was quiet, so he was home. We had taken the kids to a local park and had come home and had dinner, and we had friends coming over for dessert and coffee that night. And at 7:25, we heard the screech of brakes out in front of our house. The kids had been playing in the backyard and had wandered out front, and Heather had been hit by a car.
How old was she?
She was 5. She had just finished kindergarten.
What kind of emotions did you experience, Doctor, when you were dealing with the death of your child and how it related to your abortion practice?
The word devastated doesn't even come close to how you feel. But what do you do after a disaster? And you take a couple of weeks off and then you try to get back into your life. And after going back to practice a couple of weeks later, and I don't remember, and see at the time my partner and I were doing second trimester D&E abortions. These are relatively few physicians did them, And as I briefly mentioned earlier, I mean, a D&E second trimester abortion is literally tearing a baby to pieces. And I don't remember when that first D&E abortion was scheduled after her death, but I showed up at OR number 9 at Albany Medical Center in Albany, New York, where we worked, you know, like I had countless times before. And this is routine. This was routine to me at this point. You know, I wasn't even thinking of it as something special. Obviously, I had a lot of other things on my mind. One of the instruments that you use during that procedure is called a Sofer clamp. Basically, it's a clamp that's used to literally dismember or rip these babies apart. And I remember putting that clamp inside the uterus and pulling like you always have to be able to get pieces out, and out came an arm or a leg. And I remember just staring at it in the clamp, and I just froze for a second. I mean, this just absolutely made me sick. And this is something, as I said, that was routine to me. Sick or not, well, as I said earlier, once you start an abortion, you can't stop. You've got to get all the pieces. And I know it sounds strange to people, but it was absolutely true. You know, after going through the second trimester abortion soon after her death and looking down at this pile of goo on the table that used to be somebody's son or daughter, that was just major crisis time for me. We used to make $600 to $700 cash to do a second trimester D&E abortion. And it was 15 minutes to actually do the procedure. It's a lot of money in 15 minutes. You know, but for the first time in my life, I didn't see how somehow I was a great doctor helping out my patients, and I didn't see her wonderful right to choose, and I didn't even see the $600 cash I just made in 15 minutes. All I could see was somebody's son or daughter. And it occurred to me that, you know, this lady had come to me, not literally, no patient has ever said this or ever will, but this lady really did come to me and said, here's $600 cash, kill my baby. And I was the kind of person that would look right back at her and say, why, sure, I'll do that, no problem. This was a crisis with a capital C.
For Tony Levatino, the death of his 5-year-old daughter had brought the value of life to the forefront of his mind.
As Seal would say, you know, she always knew when I had an abortion scheduled the next day because I was just absolutely miserable to be around. And I'd gotten into a blame game. You know, it was the girl's fault for getting pregnant, and it was the hospital's fault for allowing them, it was the nurse's fault for scheduling them, it was everybody's fault but my own. And between the loss of our daughter and what was, you know, the way we were not together and all of this, she literally packed a bag one night and was ready to go.
I was taking our son and I was leaving. And I just looked at him and I said, you know, it's not the girl's fault, and it's not the hospital's fault, and it's not the nurse's fault, it's your fault. If this is causing you so much pain, why don't you just quit?
And what was your response to that?
My response to that was the next day to go back to my partners and tell them that I would no longer do second trimester D&E abortions. I said because there were so few physicians willing to do them, it was really just up to 4 physicians in my group, only 2 of us were doing these late-term abortions. And I went back and announced that I just couldn't do this anymore, it was too stressful. But hard-headed, I was going to do the first trimester abortions, the little ones that we do in the office. And I soldiered on with that a few more months. But, you know, when you've made that kind of transition, when you understand that killing a baby this big for money is wrong, it doesn't take you too long to figure out that it doesn't matter if the baby is this big or this big or this big or maybe even just this big. It's all the same. And it was February of 1985. I'm ashamed to say it was that long after her death, but that I went back to my partners a second time, and I told them I would no longer do abortions, and I haven't. How do you make up for killing somebody? I mean, how do you make up for that? We run into this. I mean, I know I went through it. I know that, and we see it all the time. And the pro boards always talk about, well, what are you talking about post-abortion stress? All we ever see in our patients' faces is relief. And they're absolutely right. They are absolutely right. As an abortionist, the first emotion I ever saw in my patients' eyes was relief. It's over. The stress is over. The problem's solved. But it isn't always solved. And they, you know, when somebody, and again, I can understand that when you run an abortion clinic, you see somebody come in, they get their abortion, they're out of there, and you may never see them again. When you do it, I wasn't running an abortion clinic. I was in a regular OBGYN office. These were my patients. And I kept on seeing them afterwards. And I could tell you numerous stories of women who would come in with all kinds of problems, infertility or all kinds of problems afterwards, who realized years later perhaps that they may have thrown away their only chance at having a child.
What advice would you have for doctors who are currently doing abortions?
Doing what we do as abortionists. Literally taking somebody's son or daughter and tearing them apart. It sounds awful, but turning them into hamburger has an effect on that patient. Obviously, it has an immediate effect on that child. That son or daughter has a purpose in life, and we've just destroyed that. It's going to have effects on that young lady and her partner, whether it's a husband or a boyfriend. It affects everyone around them. And we're the instruments by which that happens. And whether you realize it or not, it has a horrendous effect on you and your own family as well. Because that's certainly what we've learned over there. There's so much language out there. This is just a fetus. It's a blob of cells. If you're pregnant, you are carrying your son or daughter. Your son or daughter is totally dependent on you, both now and in the future. Your son or daughter has a real purpose in life. God does not create junk. No matter what your circumstances, you can give your son or daughter something that no one else can give him or her, and that's the chance to live.
Dr. Levatino is a board-certified obstetrician gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OB/GYN at the Albany Medical College. And Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I did over 1,200 abortions over a 4-year period in private practice, not counting the ones that I did during my training. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you've pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times. Sometimes the little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.